Bart, how's it going?
I'm better than you'd expect looking like this.
Wow, I'm sure it takes a lot of work to look that good too, and you're going to tell us all about that. Let's cut to the chase. Exciting show today. We've got Dr. Colton Thacker on.
Colton Thacker, great guy, perfectionist, very dedicated to his work, and he's excited by learning and doing things, and he's a real asset to our practice.
Yeah, he's added a lot. I mean, he's actually taken sort of top quality imaging out into the field, ultrasounds, lamenesses, follow-up work for things in the hospital, and also doing some sales work.
Took a lot of discipline to get the knowledge base that he's got. Really proud of where he's at, and he's a real asset to us.
Yeah, no, it's good. So coming up next on Stall Side, we're talking to Dr. Colton Thacker from Rood and Riddle, who's out in the field there doing high-quality imaging. Dr. Thacker, welcome to Stall Side.
Thank you. Thank you for having me.
Yeah, thanks for coming in today.
Yeah. Tell us a bit about yourself.
I grew up in Utah, just outside of Salt Lake City, a little town called West Bountiful. Grew up with a love for horses and riding. The oldest of 4 kids with 3 younger sisters, and the horses were just part of our lives. So,
sounds like you got quite the horse background. So everybody knows about imaging in a hospital situation, but you have actually taken it out into the field. So tell us about what you do.
Yeah, so I got into veterinary medicine by, I guess, by chance or by guidance. I was kind of at a crossroad, didn't know what I wanted to do in life. And my grandfather always given me the advice of, be a doctor, lawyer, or a businessman. And I think the veterinarian suited me best. So that's the route I took. A couple times doubted that, but, kept on that route and ended up coming out here after I graduated from Utah State, Washington State program in 2016. I came in for an internship under Dr. Barber. As an ambulatory intern.
I was going to say, I was a little worried that we were skipping way too far ahead, that we just went from birth to imaging, there's some important stuff in between.
Well, I know. Obviously, you think being on an accelerated program here. I mean, just like, you want to hear any juicy details on your life. I mean, who were your mentors? Who guided you along this pathway to get here? Besides Bart, of course, because he's been a leading light for so many people in this practice.
Yeah, there's better mentors out there, for sure.
I've had a lot of mentors here, especially here at Rood and Riddle. So my first year here was great under Dr. Barber, and then also Dr. Hyde joined us as well at that same time. And then was given an opportunity to do an imaging fellowship here in hospital under Dr. Katie Garrett, and was able to rotate through our surgeons and spend time with them doing lameness exams and in surgeries, and really getting to know the basics of ultrasound.
So why did you pick that, though? What was intriguing about the imaging that made you want to do that?
I've always kind of been like a computer tech guy, so I guess the imaging kind of came natural to me. And then I just always like to know and be able to give an answer and to know why things. I don't like gray areas. I want to be like definitive answer. I don't want to just be able to tell the clients like, hey, well, I think it could be this, or I think it could be that. And that was, ultrasound was one thing that's continually been evolving and has made a lot of advancements in the last few years, to now where we have machines that are great quality and accessible and portable that we can get in the field and we can do all that. And so that was what kind of led me down that direction, I think.
And it's great to have that surgical background as well, spending time with the surgeons here, so you can actually put things together. There's one thing to say, well, this is the lesion on the screen, but to be able to sort of say, this is what it means for your horse, that's sort of a fairly unique sort of combination. So walk us through what you do.
Yeah, the side of that experience of being in the clinic and being able to interact with them and being in surgeries really helps me with my communication with clients and helping them to understand, what is the next step. We found the problem, we now know how do we fix it. And so a lot of what I do here is all ambulatory farm calls now, where I'll go out and see lame horses, backyard horses, and then of course a lot of thoroughbreds, race horses that are being laid up either post-surgery or some sort of post-injury. And so that's kind of where my focus is now with my practice, along with public sales work. I do travel to the 2-year-old sales and the yearling sales to help there and to do exams on those sales horses, so pre-purchase exams.
Yeah, so I have a horse, okay, and maybe the horse is lame, or maybe I'm looking to purchase it. Why should I get you to ultrasound that horse?
Well, I think if you are buying this horse, you're probably going to spend some money. And nowadays, everyone wants to spend their money wisely, or most people do anyways. But basis with an ultrasound or a pre-purchase exam can allow you to make an educated decision, on your investment. Some of these horses, may have different things that come up that may bother him, or it may not at all. And so if you never look, you'll never know. But by doing those pre-purchase exams and those ultrasounds prior to a sale, you can make an educated guess.
What things would you typically see, say in that sales situation? People think they're looking at this horse, they've looked at its pedigree, they look at its conformation, they like to look at it, sometimes they fall in love with it. You come along, you examine this horse. What are the things that you see that may actually be meaningful information for that client with that purchase?
Yeah, that's a big question, and that's a question that I get a lot. A lot of people see me at the sales running around, sweat dripping down my face, and don't know how I get from one barn to the next barn all the time. But, generally when I get into the part of the purchase exam at the sale is usually after a veterinarian has reviewed radiographs, a set of repository radiographs. And there may be findings on those radiographs that may indicate that we need to assess the soft tissue structures in that area. One of those most common things that, the buzzword that we hear nowadays is sesamoiditis. There's been a lot of talk about that, a lot of frustration with it, because, some of us have just struggled really knowing what kind of advice or what kind of recommendations we can give based on those findings. And so the ultrasound exam of the suspensory branches at the attachments of those sesamoids, that's where the ultrasound has really been helpful in helping clients decide, whether they can take the risk and purchase a yearling or even a 2-year-old and go forward with it.
You do a lot of sales work now.
Right.
How does what Colton does help you make those decisions? You see radiographic changes. What do you look for, and when do you call Colton?
Yeah, because, like Colton said, the radiographs are just showing the bone. That's it. And they bring up questions about what's going on with the soft tissue. So being able to take that ultrasound and being able to interpret it and have somebody that knows what they're doing looking at that is incredibly helpful, because what's going on with those soft tissue structures, right?
Yeah. And these are in horses which, have been offered for sale and hopefully being put to sale when they are sound, and maybe you're finding things that aren't sort of clinically overtly obvious. When you're called into a lameness situation, what's your approach?
Well, my first approach is if it's just a brand new lameness, no one's looked at, the lameness hasn't been diagnosed yet, or the limb hasn't been diagnosed with lameness, is the first thing is to start with an anesthetic block, local blocks to determine where the lameness is coming from. And then once you go from there, generally it's, depending on where the area is, you may choose to go with this ultrasound first or maybe radiographs first. I get called in for a lot of second opinions or, when they want the ultrasound. And so generally that's going to be with a horse that has a known history of a soft tissue injury or, something abnormal on the radiographs, that comes into play.
Okay. What do you enjoy most about what you do? It sounds like, as you say, you're a computer guy. That's like a natural thing for somebody that's a computer guy to actually get some imaging. But what really drives you to put those two together?
I think just like on the side of new advancements and new technology, and being able to apply it to medicine, and apply it to improve, our quality of medicine for the horse and to be able to help them and treat them. Ultrasound, we use it to diagnose things and injuries and stuff, but we can also use it for treatments as well. Injections, ultrasound guidance, those types of things. And so it's been a challenge for me to develop that skill, because it's not just something that comes easily. Even I still struggle. I spend a lot of time on my own in the barns and stuff, just scanning. It used to take me probably 45 minutes. I'm sure the farms hated me when I first showed up to scan a horse, but now it's much shorter than that. But so I think that's probably what really gives me the drive, is just it's always something new. You never know what you're going to find. You kind of go into it thinking you're going to find one thing, and you get a curveball and you find something different. Yeah,
and I wouldn't apologize for taking your time, because the thing is, speed comes with time, and you want to be thorough, right? Because it's those subtle changes that make so much difference, and that's why I call somebody like you, because I don't understand what's on the ultrasound.
If it comes down to being faster, right?
Yeah.
I think most people choose the latter.
Yeah, choose the latter, yeah. So you mentioned about advancements in ultrasound. And again, the machines we have these days are just light years ahead of what things were. But you mentioned that there's more advancements coming down the line. What are they, and how are they going to help you interpret better what you see?
I think just the portability of the machines and the resolution that you can get from such a small device. And then because it is being used so widely for not only lameness exams, but just for, general health exams, you might find a bump or something here or there. And so, it's really being used as a key tool in veterinary medicine. And I think as long as veterinarians continue to use that and do that, there's always going to be a push for, increasing that technology.
You mentioned using diagnostic regional anesthetics to get to, or analgesics to get to the area where it is. So I have a lame horse. My horse is lame in the front leg. What's your approach, and what are the things you're most likely to see?
Yeah, probably the most likely to see is a front lameness. Probably it's going to start out low and work myself up the leg. A lot of times you'll see something in the foot. Probably 90% of it is going to be within the foot most of the time. And then if it's not there, you kind of work your way up through the pasture and fetlock region, and then proximal suspensories. As far as race horses go, probably proximal suspensories is mostly what I see right now. Strains or some sort of tears. And then, of course, tendon injuries as well.
Okay. And around the joints themselves, what sort of lesions do you see? Because you mentioned tendons, but there's things that you see around the joint which make a difference too.
Yeah. So on the ultrasound, you can assess the bone, the margin of the bones to see, if there's any osteoarthritis starting to form. You can also assess the fluid within the joint. That can give you some hints as to, what's going on. Is there inflammation there? Is there a possible infection there? Sometimes if you're seeing horses with a wound or a recent, cellulitis or something like that, you might find a foreign body, around those joints that have maybe punctured the joint and caused, sepsis or something. Mm-hmm. And so those are a lot of things that you'll look for. It's just not just the collateral ligaments and the ligaments around the fetlock, but you also look at the bony margins of the joint and the fluid within it, and that can give you a pretty good idea of what's going on in the joint.
You brought some images along for us today. Would you like to show those now?
Yeah, I brought a couple images. Here, just this one here is just kind of shows us a tendon that we commonly scan at sales, and this one here has a little dark area here. So with ultrasound, we refer to the structure, the echo texture of the image in like a gray map, I guess, black and white. And so black is going to be more like fluid, and then white's going to be more, kind of like that's like the actual tissue. So this here is a superficial digital flexor tendon that's right here. And, it looks pretty homogeneous, same across the board there, but it is enlarged. See if my mouse here will work. So you can see here, this is superficial here, and it's quite enlarged. And this is a common finding that we see at the yearling cells, and yearlings have a profile along their tendon. No tear or, hole in this one or disruption in fiber pattern, but it is enlarged and there is inflammation within that. This next screen here shows you, this is from the same horse. This is the left leg, and then this one over here is the right leg. And so, our superficials here, and you can see, there's a significant difference in size. And so as I'm scanning, I'm looking at, not only the echo texture and what the structure looks like, but I'm also looking at what the size is and trying to compare that a lot of times to the contralateral limb.
That's actually really quite impressive, the difference in size, and so that's a really good key, isn't it? Because I'm sure you get asked the question, my horse is lame in this leg, why are you scanning the other one? But that just really emphasizes the importance of looking at the other limb.
Yeah, it's so important. I mean, you'll scan something and you think it looks pretty normal, and then you scan the other side and it's like, wow, this is significantly different. And so it really helps to find those subtle differences or those subtle things that you might not see on an ultrasound to someone that's inexperienced, that you can really just scan the other leg. And see.
So the next question is going to be, what does that mean?
Yeah, so what does that mean? We have lots of studies that, have been done, and current studies that are going on to, determine what ultrasound findings are significant and which are not. In the case of this horse here, he likely needs some time, just, a training schedule that's, specific for him, some time, and probably some special treatments such as anti-inflammatories or laser would be commonly what people would use to treat the juvenile tendinitis. And so this case, we could tell the owner, you say, hey, you know what, you're going to need give it a little time. He's not going to be a real early horse to race. But if you're willing to have some patience with him, he'll likely be okay. So
in a sales situation, though, that wouldn't be something you'd say, that tendon's great big, don't buy the horse.
Yeah, definitely not.
Well, this really hammers home the importance of follow-up, because this is obviously just dynamic. Like, okay, tendon's big. It's not going to stay big. It's going to be dynamic. It's going to respond to the things that are done to the horse. They can make the situation better or worse depending on how they handle it. So this really emphasizes the fact that this is just not one and done. This is a series of imaging visits that this horse should have to get the best possible result.
Yeah, and that's a key thing with ultrasound, is following up, and rechecking and seeing how things are progressing. Are they getting worse? Is this training schedule too much right now? Does it need to back off? Do we need to move forward? And, that's brings it up to, an important thing, because ultrasound is so dynamic, and it can be very dependent on the user. So sometimes it's very important to follow it up with the same person scanning it. Mm-hmm. With technology and everything, we can share images and we can get all that, to other people and they can review it. But really the person with the probe in their hand is one that's going to be able to tell the best of what's really going on.
And you brought up an important point, though, because as we're using ultrasound more and more in sound horses, right? Because it's easy to say, here's the lameness, and be able to pin down a problem. But when we're using it on sound horses as part of a pre-purchase, we're running into a lot of stuff that we don't know whether it's normal or it's abnormal, or maybe it is an abnormal finding, but is a significant abnormal finding. Could you comment on that?
Yeah, I think that's where a lot of people get hung up. You think I walk into the stall and say, hey, I want to ultrasound this horse at a sale, and it gets the consigners all kind of worked up. Well, there's nothing on radiographs. Well, why are we scanning it? And that's just a piece of the puzzle that the client has requested to help in making their decision. And even if we do scan it and we don't find anything, or we do find something that's there that's not normal, it doesn't mean it's a bad thing. A lot of times horses are going to have variation of normal between horses, and so it's important to be able to know what those are and be able to tell the clients and give them assurance that, hey, yeah, this is not normal, but you will be okay.
Yeah, I suppose you have unexpected findings, but they're normal for that horse.
Correct.
And you're only going to tell that by experience and serial exams, if you're in a situation where you can get those serial exams. Do you have any other images for us?
Yeah, I'm sure a lot of people are probably more interested in seeing what we look at. Suspensory branches are probably the most common thing I look at in yearlings, especially at the sale. This here is a normal suspensory branch. It's actually the right front of the medial branch on the inside. So again, we can assess the bone, the sesamoid bone, where the sesamoiditis would be associated. That's right along this margin here and this margin here. And then we can see the fiber pattern, how it's nice and parallel, nice and tight. It's inserting there. It's all very normal. This one here is an image from a yearling at the sale of a left hind branch. That's a lateral branch, but we can see here that there's some significant changes in the fiber pattern here, and then also within the bone. This horse here had a fairly good sized lucency on the sesamoid on the radiographs, and you can see that he's kind of got some little fragments that are starting to pull off here. And so this here would bring a little bit of caution to me, just because we're starting to see some bony changes here, as well as the soft tissue ligament changes. I don't think it would be a deal killer, but it would definitely be something to, the buyer would need to know, like, hey, let's proceed with a little bit of caution.
So that's a good question, though. What is your involvement then when you find something on the radiographs? Do you look at the client and say, is it a green light, red light for you? Do you say buy the horse, don't buy the horse?
No, it's more of a discussion for me. It's more of, and I do a lot of work for veterinarians as well, and so it's discussing with that veterinarian of, my opinion of what it looks like at this point in time. A lot of the sale horses I haven't scanned previously, I'm looking at them for the first time. And so I'll say, hey, this is what it looks like, this is my opinion of it, and then we kind of have a discussion about what risks the client is can tolerate or not, Yeah. And so it's never a yes or no, never a green light, red light, or pass fail, contrary to what a lot of people would think. But it's a discussion, and that's where that veterinary client relationship really comes into play, and is a key thing.
I think that's important to point out, because a lot of times we'll be out at the sales and consigners will want to know, did you pass the horse or did you fail the horse? Mm-hmm. And the answer is no. We didn't do either one. It's like Colton said, it's a discussion, and what is acceptable for one client may not be acceptable for another. And there's so many factors that go into it. The client's risk tolerance, how much they plan to pay for the horse, what they plan to use the horse for, mm-hmm. right? Are they going on to the next level to race, or are they going to resell the horse? And so those are just conversations we have all the time with clients, and then they make the decision whether or not they're going to buy the horse.
Yeah, I think it's the experience of the client as well, because if they've been in the industry a long time, they've seen the less than perfect horse do well. And if people haven't spent so much time in the industry, they're trying to buy the image of the perfect horse. Well, when does that happen? I mean, if you look, you're always going to find something. But again, is this significant? And that's what gets back to what you said before. Research is ongoing. As imaging gets better, we're finding more stuff. Is it or is it not clinically important?
Yeah. I'm just, that's the biggest thing for me is just to be able to look back and see all the horses that I have scanned in the last 5 or 6 years. I'm starting to get enough data that I can actually look back and put it together and try to make sense of it all. Because there will be horses that I've seen not quite to this extent, maybe a little bit more like this next image that's here on the screen. Some people might call this a tear, and as soon as they hear the word tear, they walk away. But that's not necessarily a bad thing. There's a horse I know that has a similar lesion to this one that started in multiple grade 1 winner. So just because that's abnormal or you're finding things that are not perfect, doesn't mean the horse is not going to have the ability to perform and to reach a high level of performance.
You can also ultrasound other structures besides tendons and bone joints. It's always fascinated me that you actually look into, say, the stifle joint. Talk to us about that.
Yeah, I do a lot of other structures throughout the horse. And a lot of those come in like with foals and stuff. We'll scan fractured ribs on the farms. We'll scan abdomens or lungs a lot commonly, but I'll scan bumps and wounds. I had one just a couple weeks ago, I guess, that came in and had a draining tract that a veterinarian had put 2 or 3 different drains in, but it kept draining and kept having a bunch of material coming out of it. And we scanned it and was able to find a large piece of wood. It was about 2.5 inches. And so, it's able to help you really make a treatment plan with some of these cases that maybe you haven't been able to look.
Yeah. Do you have any backing off from the images that you've given us? Do you have any images which sort of describe how you hold the probe and how the probe sends out the sound and what sort of structures it sees? Sort of cross-sectional imaging, if possible.
Kind of. So here's just some screen image that kind of shows us the basics of the ultrasound physics here. We have the probe here. There's different frequencies of probes, different probes that you use for different structures, but this here's for the limb. And so the ultrasound will send out high frequency sound waves that are able to produce an image in real time. So these sound waves, like the yellow arrows, come out. They're transmitted into the structure that you're scanning, interacts with the tissues here, and then based on the characteristics of that tissue or that structure, the sound waves will be reverted back to the probe. Sometimes they get scattered, sometimes they're absorbed, but for the most part, they're going to react, and eventually they're going to get back to the probe. And then those signals come back, and the computer or the laptop there will kind of make up a grayscale image for you. And so, depending on what structure you're using, and depending on just your patient here, this horse here has a lot of hair on there, so it might be a little bit harder to scan this horse because air is really good at trapping air, or hair is really good at trapping air, and that can make it to where you can't really visualize or image the structure that you're wanting to. And so sometimes you have to do certain things with your patient, as far as clipping the hair or cleaning or using alcohol or something like that to get the best image that you can.
So you mentioned tendons, how they look. You mentioned sort of bone, how they look. What other structures do you ultrasound, and how do they look on the screen in comparison? So I mentioned like ultrasounding a joint before. How would the joint look to you?
Yeah, so a joint that is, let's say a septic joint in a foal, the foal's lame and it has a little bit of fluid there, but maybe someone's a little scared to stick a needle in it just yet on the farm. You can stick the probe on there and see what color the fluid looks like. If it's pretty clear and typically low in cell volume, it'll be pretty black. But the higher in cell volume you get, it's going to be a little bit more gray. Now, the ultrasound's not going to tell you whether it's septic or not. It's not going to tell you what the cell count is, but it can just maybe lead you to more like, hey, no, we really need to get a sample, or hey, no, let's hold off. And I think that's the biggest key with ultrasound is it's another tool. You can't just take it and just run with just the findings you see on the ultrasound. You've got to put it with your clinical exam. You've got to put it with all the other things that you're looking at in a horse.
Yeah, I think that's the same thing as radiographs, sort of along the line Bart was talking about before. So it tells you a little bit about the bone, but it doesn't really tell you what's necessarily going on.
Yeah, and they're all when you put it all together.
Yeah,
it's not one thing is the be all end all. There's, and you can never underestimate what you can do with your fingers and your eyes.
Yeah,
and then just put it all together.
Yeah, and what I do, like, it's different than what you do, but an ultrasound, I mean, you're right, the diagnosis is made between the ears, but the ultrasound makes you so much better, and you can get information you can't get. But it's no substitute for, like, standing back and looking at the horse and doing the regional analgesia you talk about to find out which limb it is in the first place, because it's not a lameness meter, right?
Yep.
Right, exactly.
It's not a horseogram.
No, definitely not.
Yeah. Well, this has been fascinating, Colton. I mean, this has really opened my eyes to what can be done in the field pretty readily.
Yeah. I do have one other question. Who's your inspiration behind your mustache?
My mustache. I don't know if I have an inspiration behind a mustache. I think it was just try something new and do something different.
I was seeing Ernest Hemingway myself.
Wyatt Earp?
Wyatt Earp. Oh, now we're rolling.
I like it.
Yeah, now we've gone a little bit further west than I thought we were.
Yeah, but that's Colton's roots.
Go back west. Yeah.
Well,
No, I actually started. I guess I hadn't shaved for a couple of days, and I left it. Walked down for Thanksgiving dinner to see if my wife would even notice, and she didn't even notice. So I kept it for 2 or 3 days before she finally noticed.
So what are you doing?
Yep.
Yeah, nothing like an attentive spouse.
Nope. So it's here to stay for a little while.
Yeah, that's great. Well, again, Colton, thanks for coming in and talking to us about what you do, and thanks for bringing those images. And I'd strongly encourage anybody to go and look at the video version of this podcast to see those images, because they were really good.
Thank you.
Yeah, no, appreciate you being in. Thank you very much.
Thanks for having me.
And that was Stallside for this week. We've been talking to Dr. Colton Thacker about ultrasound in the field and what can be done. See you next time.